I'm going to conclude by bringing you the Starting Well core initiative and where we're coming from in NHS England. I've used the phrase putting the mouth back in the body, which I'm sure some of you heard. The Chief Dental Officer uses that a lot, but actually it encompasses what it is that we are talking about today and some of the discussions that's ongoing, and I'm hopeful that this will bring on the area. It's small steps. We did invite many, but we've had a few people attend from outside the dental sphere, but the intention is to get back into that sort of arena so that we're integral part of healthcare. Children's oral health is everyone's business. We put that out there today as the title for what the paediatric dentist was going to speak to you about, and putting the mouth back in the body, as I said. And really the link is to say that a person can't really have good general health without good oral health. And also the other thing is, I'm saying here comes the dental team. So this is what we can do. Some of you are already involved with Starting Well, so you kind of know about that. John talked about the upstream and downstream, and I know that we are dealing with the Starting Well, and I know dental practices also like to talk about fluoridation and things like that, which I won't skip, I promise you. So I'm a dentist. This is my team, not in Leicestershire, and the team delivers the service together. Equipment-wise and everything is pretty similar. I suppose we're bigger. We've got a 12 surgery practice, so we're sort of bigger than the average dental practice, but everything runs just about the same. That's our living, or the waiting room, as it were. Some days it looks quite serene, and other days it does look like A&E. That's just the way it is, isn't it? And I suppose the first message in terms of what we could do is dental practices are safe and well-regulated environments, and with a high level of satisfaction from patients. So I actually feel we can do far more in healthcare in general than we are doing at the moment. The question is, what can we do? And in a nutshell, this is infographics from the British Dental Association talking about CQC assessments of dental practices. And you will see along there the key factors that they're looking, whether it's caring, safe, effective, well-led, and responsive. And the good news was, this is the first report that they did, was that we were found to be the best sector overall. Now, some people say that's because money exchanged hands, so we have to up our game. Nevertheless, I think it's something we should be really, really proud of. And actually, the last report, and you can see at the top there, actually showed us to be still doing very well for the patients that we see. So what can we do, and why is it that we're not doing that? Well, I think we can take a part in actually preventing patients attending A&E as well as GPs. Certainly, I hear from my medical colleagues, the LMC chair, that occasionally people would turn up to the doctors with dental pain, with dental abscesses. And also I hear that people attend A&E for that. Now, there may be patient charge revenue involved in here, but nevertheless, that's happening. But also, I want to take it one step further and say that actually some of our practices are actually quite well adapted to treat cases that maybe should not be destined for A&E. Diabetes has been talked about. We know about the bidirectional effects of what we do with periodontal disease as well as diabetes. But also, I don't see any reason why a dental practice couldn't play a really integral part, not just in terms of prevention, but actually carrying out some of the functions that you would hope you would see in a hospital with diabetic patients. And of course, nutrition. These are things that just linked in with things that we do, and we don't kind of think about that. Smoking cessation services, we talked about that. Surgery is here, but going back to PCT time, the idea was dental practices were supposed to get involved in this, and PCTs, we're now some 13 years later, and it hasn't happened. And, taking bloods and things like that, blood pressure, and oral cancer, one of the most integral part that we do, that's healthcare. And we know our role in that. But the question I got asked by NHS England's medical director was, why aren't we doing leukoplakia reviews, which are commissioned by the CCGs? We have the oral surgeons, we pick them up, we send them to the same people, they work in our practice, but we have no part in that. I don't quite know the answer, but that is a decent question to ask. And this is from my website, but I reckon if I picked out from your websites, and you'll have this, we offer aesthetics, don't we? We offer implants, we offer all these kind of things. So we can offer things that are not what people see as mainstream dentistry. Why is it that we can't offer things that's to do with the rest of healthcare? There might be fundamental reasons for that, but that's kind of the area that I'd like to kind of explore. And talking of oral cancer, I'm old enough, and some of you in the room are as well, to remember a time when we didn't think that was part of our role, did we? We thought we dealt with teeth. But I don't think anyone in the room would argue that the oral cancer screening within our practices is actually an integral part of what we do in the practice. I just realised, Laura, that's you in that photo, isn't it? Yeah, I think it is. So we did some work with the local authority, and also you took the foundation dentist, wasn't it? You took foundation dentists out, and the public really loved the fact that the dentists were actually there in the shopping centres and everything else. And of course the others are sort of in the practice, and I think that's the foundation dentist there again, checking, doing oral health checks and everything else. And I think that's kind of what we do. But it's surprising. We hold an oral cancer free screening for anyone that wants to, whether they're a patient or not. Very few people access it. And then you get people who actually attend the practice normally not aware that it was being done. And then they say, well, does he do that? Yes, he does that every time he sees you. And that's interesting, isn't it? It's the conversations we're having. And when it comes to oral cancer, this is statistics from the Cancer Research UK. You talk about, the top line is the number of cases in the UK, and the right-hand side is the prevention. So what percentage of cancers is preventable, was considered preventable? So for general cancers, you're talking about 42%. But for oral cancer, it is considered to be 91% preventable. Now that needs some thinking, doesn't it? We have patients attending our surgeries when they're fit and healthy. The rest of healthcare don't. Nobody goes into the GP just to check, really, and make sure everything is still running smoothly if they're okay. But we have these people, and in fact, if there's a criticism of NHS dentistry, it's probably the fact that it is the inverse care law, isn't it? The people that need it, let's keep accessing us. But nevertheless, there's an opportunity there to deliver the prevention messages. And one of the main prevention messages, what we're talking about today, is the dental check by one, and what we're going to do with that. I support this, and I think the profession really supports this, and it's something that is integral to Starting Well core. I'm not going to go over that because you've had that about what the effects are, but there's the direct and indirect costs, and also some with very good evidence and some with slightly weaker evidence, but the evidence is there linking the two. And also, following on from what John was saying, really it's about, and the discussions in fact we had next door, is about the common risk factor approach. You know, you are giving advice, you're asking about the diet and the smoking and the alcohol, aren't you? So you're actually asking about these things anyway. So, you know, it is a case of that we are part of the healthcare system and that we're giving those advice, and really we should be taking part in all that. To give you some background, this is NHS Central Midlands, as I said, for as long as it exists. I got approval to run 5 events. This is event number 3. And across this patch is actually a very diverse situation. We were in Hertfordshire last week. Hertfordshire is almost a different country to Lincolnshire. I've held a teleconference where we've had from Hertfordshire up to Lincolnshire with the 4 sites across NHS England, and I have to say that some people just looking, is that what they have? The workforce down in Hertfordshire right next to London is very different to Lincolnshire. The acute sites, obviously we have the hospitals that provide the services there, and that's the statistics that we had from our direct commissioning plan. So it covers the 5 STP, and one of the reasons why we're holding the 5 events is that the 5 events are in the 5 STP areas, and we're told this is the direction of travel, and as dental, we should be part of that. It includes 629 primary care contracts, by the way, and serving a population base of about 4.8 million. Some of you have seen this slide. I think, in fact, last time I was here, I think it was the Starting Well launch, wasn't it? I had man flu and I couldn't talk by the end of it. But I showed this slide, and this is again from our slides from NHS England. And the left side is life expectancy at birth, and the right column is the mortality rate from causes considered preventable. And there were 2 real areas, I know there's a third one there, but 2 real areas that flagged on both. And they happen to be Leicester and Luton. There's a link there, in which I'll explain. And actually, it is the fact that everything is linked, isn't it? It's not just people coming with one problem, it's overall the issue. What we've been doing with the managed clinical networks is working through the pathway down in this area for patients to go through in the dental. And what we're looking to do, which I'm about to go into, is how we integrate that into the rest of healthcare with the direction that things are going. You've already heard from our local authority partners, and the thing that's not very well known, although I suspect people are beginning to gather, was that the oral healthcare, the health and care system is slightly complex. The local authority have their responsibilities to commissioning of oral health surveys and oral health improvement. NHS England has the whole pathway, which is slightly unusual in healthcare. And in Public Health England, where you've seen John supporting and Health Education England, we had representatives from there. And it's partnership working, the board is partnership working, but actually it requires partnership working across the board. So I'm not going to labour this point, but some of you will know, some of you won't. The move towards the STP, the Sustainability and Transformation Partnership, and really what we're trying to find is how we fit into that service. Interesting, this was one of the things, I'm doing a piece of work for NHS England for workforce, the dental workforce, and one of the key problems is rurality. And it's coming across loud and clear that if you look across the country, wherever, the more rural it is, the more problems that we have with the dental workforce in particular. And that is why I think when we have locality-based, it's far better. Because as I said, when you've got areas as diverse as Hertfordshire or Lincolnshire, for example, you need to have the local intelligence in there. So I'm not going to run through these slides. I'm going to sort of pick out what the dental vision is for the future and try and sort of, I suppose, convey that with you, and then try and maybe have a discussion at the end as to where that fits in. So we've been concerned with pathways, and those of you that attend the network and the dental network and the managed clinical network will know that. And we're trying to find how the oral health services working in the neighbourhoods fit in with the rest of wider healthcare. Starting well falls within developments of how dental practices could be used to increase the functions, if you like, of what the dental team does. I think for a while, and the discussion we always had, and as I said, this is event 3, was actually sometimes patients are surprised we want to see them as early as we do. That's because we didn't know that. And the future, whoever it may be, running dental networks across the STP will play a key role in developing that dental strategy. We still see that as the continuation, although I have no news for you as to what happens soon. In terms of the shared consensus, you can see other organisations talking about STPs in broad terms about the fact that this is currently the way that the health and social care system is working, and really my point is that dental need to be part of it. I gave a presentation actually to the STP in Leicestershire. It's LLR as the STP, the prevention board. And I think it went down very well. And then 3 or 4 months later, I got a list of questions from it, and it was all about eye health. So it just meant that someone didn't quite listen to what it was that I was saying, perhaps. So these STPs are moving into integrated care systems. You don't have to worry about the details, but what I'm trying to tell you is that this is where we're going to have to get involved in the future. And what we will do is continue to work with the managed clinical networks and develop the dental strategy. And that's what I spend my time with NHS England trying to do, and supporting practice and improving quality. We've appointed managed clinical network chairs. So overall, we support about 12 managed clinical networks. And if you work that out for, it's quite a few meetings during the year. We don't have meetings for the sake of it, and we utilise the specialists that are in the area to give us that advice so that we can improve patient care. And the future really is trying to link general dental practice, the place where the majority of you are coming from, to the rest of the STP working in primary care networks, and really making sure the patient receives the care and advice in the correct setting. Okay? So that's kind of what we're looking at. I borrowed this slide from Mouth Care Matters. Some of you may know about this initiative, which I think is excellent, and really about the systemic health link. And as I said, some have been raised, but we know certainly something like aspiration pneumonia is probably very high up in the evidence that it can have an impact. And we're seeing Mouth Care Matters being implemented across parts of Central Midlands, and it's something that we would like to see continued in acute trusts in hospitals. And really, the idea is that we're looking at the pathway, and that pathway fits within health and social care. And I know we had the discussion yesterday, and I always admit that I think dental are experts at working in silo. We're actually pretty good at it, but actually we need to look and face both the community, our local community, as well as the rest of healthcare. So I haven't got very good pictures like that Jancy has from the teeth, but we know that these kind of cases come into our surgeries. So going back to children's oral health, why we're here, what can we do? John has covered some of the areas, and essentially we're looking at a picture where the number of I think John was giving, was it 0 to 1, 0 to 2, the details, is it 2% or 5%? So very, very low figures. But even at 5-year-olds is 33% attending. By the way, for a service that is free. And that was one of the discussion points that we had next door, which is actually a lot of people, maybe from Eastern European countries, don't actually know it's free. And it's not pushed out there as much because they were used to paying for it. And also the fluoride varnish rate, where we kind of come in terms of our role. We have, of course, Delivering Better Oral Health has been mentioned to you today, so I won't go into that. But also, and those of you that have heard me speak about this, we actually have a professional duty. So it's clearly stated for those of you who are registrants that we provide good quality care based on current evidence and authoritative guidance. Regardless of what you feel about that guidance, regardless of what you feel about the evidence, and which is why I think it's really valuable for John to say, look, this is the current evidence. We have a professional duty to follow that. Plus, your NHS England forms that go in terms of the FP17 has a section on it that says that you have achieved best practice prevention according to Delivering Better Oral Health. So every time you send in the form for the NHS care, you have to tick that box to say that you've done that. So I just think, we just need to be aware that's the setting that we have. But also, in terms of improving children's oral health, obviously there's a contract reform program going on. Also, nationally, there's a Children's Oral Health Improvement Programme board going on, but also Starting Well and Dental Check by One are critical parts of it, and that's what we're trying to talk to you about today. I won't talk to the impact, everyone's talked about that, but you can't have escaped the press. Yeah, you've all seen these in the last few years. Actually, it's kind of really grown, because I think if you go back 5 to 10 years, you didn't see very much of this at all. So, what did we do? What are we going to do about it, and what has been said? So there was a ministerial declaration, effectively, at BDA conference in 2016, that whilst they were waiting for the report from the Child Oral Health Improvement Board, NHS England was tasked to work for 10 identified high-risk areas. That's what Starting Well was. So the ministerial diktat says, this is what you should do, and then those areas were picked. Now, what do we do in terms of improving children's oral health? Some of this you've heard before, but I'm going to try and piece it all together. Radical upgrade in prevention has been talked about, and I think we still need to grab hold of that. Reducing sugar intake, increasing fluoride, improving access, and reinforce education. And I'll just rattle through some of those for you. In terms of radical upgrade in prevention, some of you were here, not in this building, but for the Prevention Roadshow. We had a Prevention Roadshow in Leicestershire and in Lincolnshire, and we had some really nice discussions, and some of the resources that I'll show you in a minute actually came from the roadshow and the results of the work that was done. And so we were already doing that, and in some respect actually we're quite ahead of the game in terms of healthcare, in terms of prevention. But what we need to do, I think, is as a collective look at this, be it national or be it local, something that we need to look at. And the key is getting prevention right from birth, and you've heard from partners organisations, and actually, by the way, good feedback on our table when we were discussing next door that Leicester seemed to be more proactive at signposting people to dentists in early years than other areas. We had people that I think worked in Northamptonshire and other areas said it seems so that's actually obviously the message we were getting across. And also the other message is waiting till school age is too late. And the key is universal measures for all and targeted measures for those most in need. Then we move on to sort of reducing sugar. And they're a community-based program, but also the practice giving advice out, which we do almost every day of our practicing lives. and also education of the general population. And that's, more, if you like, upstream, isn't it? It's more what getting across that. But what is coming across in our discussions again next door was very much that it should be the same as the messages that have been sent out for diabetes and for obesity and things like that. And we should be part of those. And then we talk about increasing fluoride, and I've already talked about fluoride varnish, the fluoride toothpaste. John covered that earlier, and then with water fluoridation. And I didn't actually initially have this, but as the feedback was coming in when we were sitting in Northamptonshire for our first event, it was clear that when you talk to dental teams, you need to talk about water fluoridation. So I'm here to tell you that NHS England has a position statement on water fluoridation. Actually, some of you may not be aware of that, but that is it. And it talks about the totality, it's safe and effective public health measure, and it's talking about the totality of the evidence there, and that NHS England would support local authority or community-based ambition to invest and implement water fluoridation. It's a big move away. I recognise there are barriers to that, and this is something, and I know we're playing the long game here as well. But nevertheless, that is part of the issue, and that goes back to that thing. It's the impact, isn't it? It's not just what care is. Actually, the impact is far heavier on those in the deprived areas. So something for us to be aware of. And Public Health England produced this infographics. I think when you look at so the bottom part is about the return on investment, and the middle one there for water fluoridation, for £1 spent, the return on investment of £21.96. When you compare that with community fluoride varnish programme of £2.74, a very big move. I'm not suggesting we're anywhere near it. The East Midlands LDCs, I know, are working on something together, but it is something that we know. But the fact that I'm standing in front of you saying this actually is quite a big move. It wouldn't be so long ago that any connection with NHS England and water fluoridation wasn't allowed to be said to you. And Public Health England indeed takes less of a neutral view now, and it is something that we're pushing on. Moving on to dental access, and that's what we're talking about in terms of Starting Well core. So dental check by one. BSPD campaign, and then increasing the number of young children attending the dentist and invest in a system that encourages early attendance. But then we have to look at also reinforcing that education outwards. And there are many resources out there, apps, and I'll show you at the end actually things that you should have already had, because I've sent it out to practices at least 2 or 3 times, but I can show you a way to getting the hold of the resources and also joining an app that we've got. So the now famous Claire Stevens jar of teeth, you've seen this on the telly? Yeah, I assume most of you had. And Claire and Sarah Hurley, the Chief Dental Officer, have been going around, and they were on Breakfast TV, pushing this thing about dental check by one. So it is a campaign that was led by the BSPD, but it's a campaign I think the profession backs, and it's a campaign that NHS England backs as well. We've done this locally, so I think this is your practice actually, wasn't it? Yeah. So Liz Kendall, the local MP, wanted to, obviously they'd had the parliamentary sort of notification, wanted to see how Starting Well was implemented in the constituency. We went along, Jasmine Murphy was a consultant in dental public health at the time, and Carol Pitcher was our commissioner, and we went along to the practice, explained that to her. The lady on the right-hand side is Dr. Caroline Johnson, who was at the time Health Select Committee, the MP for Sleaford and North Hykeham. And we've been pushing. The BSPD think I carry this thing around with me. I don't actually. I do sometimes put it out when I go and see MPs and stuff, but I don't have it in my bag right now. I want to reassure you. So I suppose, what are we going to do about it? Dental check by one. How do we encourage families to access dental care by their child's first birthday? And we've talked a little bit about that. As we collect everything together, it's something we want to push on. And the second thing, which is why we're here, is are we ready for them? Do we have a baby suddenly turn up in our surgery and have people sort of running for the hills thinking, what do I do next? And that's what Starting Well Core is about, and the resources which I'll talk to you about. And you've already seen some of that. Do patients know how to access the care? We've had discussions about that. Do patients know when to access the care? And they'll still be surprised. I'm sure you've spoken to patients. Oh, bring your baby in. Really? That young? I'm not so sure. Will dentists get paid if they don't manage to carry out full examination? That was a biggie at the beginning. I think we've answered that. And what I'm trying to get across is that the dental family need to work together to push on that. And this is the note for the avoidance of doubts. Anyone not seen this before in the room? Can I just check? You can be honest, or has everyone seen this? Yeah? Good, I'm obviously doing it good. So this was issued actually September 17 by the Chief Dental Officer, and it outlines clearly on the table on the right, the prevention of caries in children up to the age 3, 0 to 6, and those that are giving concern. What you should do when the patient's in the surgery, what you should write down in your notes, and exactly what that should cover. I don't think that's onerous, and anyone that told me that it was onerous hadn't read it. So for me, I think it's something that we can all do, and you've been given the okay. And as I've said to others before, it possibly is the easiest UDA you'll make that day. So how do we make a difference? I think some of you are here with team, some of you not. I think you've got to educate the whole team, including your front desk person. You've got to spread the word and ensure families know that they're welcome. As I said, we still get surprised. We push on this pretty hard. We still get patients going, really? You want me to bring the baby in at this time? Get involved. And also for you as dental practices, it is to your gain as well. Be part of your local community as well as the dental community. So we're quite good at being part of a dental community, the fact you're here, but we're not maybe as good as being part of, I know that's a generalization, as our local community as well. And I think that's a sweet picture that was put up by someone, I think linked to the BSPD, about their grandson having their first dental check. And you all know about the knee-to-knee examination and what to do with that, but I can give you access to how you can access the videos to that as well. We've done some community work. This is from Luton. So when I was down there, they don't always lock me in the police van. And also we've had, of course, here, which you guys were praised for the work and the accreditation of dental practices, and where you had, I don't know who was Quizmaster. Was that you, Laura, who was Quizmaster at the time? Just trying to think. Someone was reading the questions, and Janet Clark, Deputy CDO, came down and did that. So we've been doing that, and of course starting well. That very thankful for you guys that came down to where we had at the Diwali festival. We had a stand there, and I always think it's really funny when you look at the other stands, which is on the right-hand side there, that were there at the place. I think we were next door to the Cadbury's or something. It was a chocolate stand, was it? Is that right? Yeah. Cold night in Leicester, I tell you. So that was good. I'm going to skip over the video, but you know we've been on the news on talking about children's oral health. Sorry, just bear with me a sec. I'll just skip that. So going back to starting well. The 13 priority areas within NHS Central Midlands, Leicester and Luton. Okay, and that links back, if you remember, the first thing that I showed you, which was the diagram about the mortality rate, and also about causes that are preventable. We have done some upskilling the skill mix. I think we must have upskilled maybe 150 or so, up to 200 DCPs in our area. And starting well was essentially a dental practice-based program, and embedding the things that we've talked about, as well as building new relationships. So those of you, I think most of the Leicester practices on the preventive practice have got a champion. Is it oral health champion or prevention champion? I can't remember what the exact term is. And that individual has the responsibility within that practice to look at the prevention pathway, do some audits. I know there's some questions about how often we audit, action plans, and doing oral health promotion boards. And then some of you are more on the advanced preventative, where there's the outreach element, and this is where we work quite closely in conjunction with our local authority partners, and go to high risk groups, adopting a setting. I know it's very easy to adopt settings, but actually not that easy to adopt settings that we really want to be in. It's again that inverse of the care. The place we want to be in don't necessarily want us to be in, but the ones that are very easy to get into, maybe not the ones that need it the most. But obviously we're going to try and make that happen with you. So what about starting well core? How does that fit in? Well, that's the initial side, the evidence base you've already heard about, and also the children's oral health. So what that starting well core does is to give you a way in which it's not just the 13 high priority areas, but how the rest of dental teams can contribute to that. I'll just skip that. So we know about the children visiting dentists and the rates that are. I'm still quite surprised when I see the slides of, under 2's been 12%, as I said, for a service that's entirely free and actually quite easy to do. We know about GA and GA spend, and I recognise this as an under calculation probably, just today. And you've heard about the fact that it's the single most common reason for a 5 to 9-year-old to attend the hospital. So in terms of what the manifesto of the Conservative government, and also indeed in terms of what government position is, it is about reforming contracts, increasing access, and particularly concentrating on oral health and particularly deprived children. That's the priority. That's the Department of Health priority for us. In terms of the local situation, you've already heard from the Oral Health Promotion Partnership Board, and as I said, that we have formed boards across the locality in Central Midlands. Lincolnshire has been up and running for quite some time. Luton, as I said, Patsy and I discussed setting that up, and that's going very well. Northamptonshire has had tentative meetings already between Dental Public Health, NHS England and the local authority. And as a result of starting World Core last week, there was someone in the audience who was from the Hertfordshire local authority and the Oral Health Alliance. I don't think the job is done. There are still some areas, but basically every STP area within Central Midlands within the next few months will have an Oral Health Promotion Partnership Board or an alliance group. So the starting well practices, as I said, in those localities. And you look at the data, I'm not going to dwell too much, but yeah, it's interesting, isn't it? That black area being Boston, Lincolnshire, suddenly the focus has switched, and that's moved around from where Leicester initially was the main focus all the time. NHS attendance, again, is something that we're looking at, 0 to 2, and how the two marry up. But I certainly think we have a role to deliver that preventative advice very early to parents. And those are the 13 priority areas. Starting Well Core is about actually increasing that access and allowing you to increase that access for the rest of England. And that is effectively what we're talking about here. So you look at the Starting Well Leicester, Starting Well Luton, and those programs that are running, but Starting Well Core is coming. For those of you from Leicestershire, from Rutland, where you haven't had Starting Well, this is what we're talking about. So it is about a commissioning approach, and I'm not standing here saying I've had approval to say we can change contracts and everything, but the discussion's ongoing. These events was an approval by my decision-making panel, primary care commissioning panel, to start to engage with you and to start to make it known that this is something that we are definitely interested in and actually giving you the tools in which to do it. So delivering practice-based preventive care and then raising the public awareness. That's what Starting Well Core is about. And people say, well, when does it start? Well, to me, it has already started. It's not at all, we will start on set dates and everything else. I recognise we've had some feedback, well, actually, I'm right up to the maximum of my contract, I can't do anything else. But actually, it's already started, we're already doing this, and lots of people are already doing this. It's just getting a collective effort together to do that. So how will it work and how does it work currently? Well, the support for the profession in terms of the training presentation and resource pack has been disseminated. And I'm hoping, I'm not going to ask for a show of hands because I know everyone will want to, that has been passed on, because I know we sent that out 2 or 3 times already. We would like NHS England to arrange the capacity so that those of you that are near the end of your contract activity, and there's a lot talked about flexible commissioning, I know I keep being asked about this, that Starting Well Core will be part of that, and seeing how that commissioning arrangements can be put to good use. Now, I have to say, with the amount of clawback, there's actually quite a few practices here, I'm assuming, aren't actually hitting their contracts at all. My practice being one of them, but it is something that we know. And then the notes for the avoidance doubt gives you the clarity around what care can be delivered and the documentation and the claims that can be made. And as I've already shown you, essentially the record keeping is clear. And I think any of your teams, you might want to laminate this or put it on a document, but what needs to take place, in order to claim for your Band 1. But the potential is this, isn't it? Whether you've got someone, a baby that's compliant, that's not, and what you do about that. And really, the outcomes that we expect is to increase the access of 0 to 2-year-olds, but also, as we increase that access, it's our role to be part of promotion of preventative care for the 0 to 2-year-olds. And that is, in effect, what we're here for and what we're talking about. Longer term benefits, apart from increasing the access, is the reduction of GAs. If I recognise that sometimes that might pick up more cases, but actually the reduction of GAs would be crucial, and also the reduction in restorative care and NHS services. That's going to be a reduction in the spend in that as well. So other benefits, we might reduce people going towards emergency department, NHS 111, antibiotic prescribing has been talked about, and also the missed school days, decreasing that as well, and the direct and indirect cost of that for you all. So before I sort of finish that, quite often I hear from dental teams that the 5-year forward view made no mention of dental and oral health. Is that correct? Yeah, people have said that. Didn't contain those words. And neither did the next steps to the NHS 5-year forward view. But I quite like what they did in Manchester, which is putting the mouth back into the body and actually having a dental strategy. But I know, Manchester obviously has its own controls up there. And this is a question asked in Parliament to Steve Brine, who's the minister responsible for dentistry, and he makes a mention sort of halfway down there about the 13 high needs areas and about 108 dental practices now participating in the national programme, and also that would be evaluated. But you've just maybe been aware of the publication of the NHS long-term plan, yeah? And I'm very pleased to report, and actually not many people, that actually dental does get a mention in it. Actually, it gets a mention in it a couple of times. There's one part about high needs and special needs, but actually it does get mentioned about starting well core. So it talks about initially about holistic care across local authority NHS services, including primary care, and it says about oral health. Then it talks about the Starting Well Core initiative. This is what we're here for, supporting the 24,000 dentists, of which a lot of you are part of that, to see more children from a young age to form good oral health habits, preventing tooth decay experienced by a quarter of England's 5-year-olds. Okay? So that is obviously quite good news. I know some people don't think it's enough, but actually it's quite a big move up the agenda. So what we did do was we sent out letters to your practices, and we've also got one for early year centres as well, and where we describe about what is happening in NHS Central Midlands and also the events that are here, but also where there's a load of resources embedded within that document. And I'm hoping that all of you have got it, or at least know that it's somewhere within the practice. If you haven't, I'll tell you where you can get it. So that you can download the resources that are there. I know that one or two of them are a bit slightly tweaked, but they're essentially there. And also, as I said, there's a similar pack of resources for health and social care and early years professional. And you can have access to this so that if you're having discussions with people in your community that are not in dental, you can actually signpost them to that. And I wanted to make you aware also that we've got a dental app that's up and running. It's actually administered by myself, but if you want to, just send, I'll give you the contact details, an email to me, and you can have access to the suite of documents that NHS England's made public, including our commissioning documents and needs assessment whenever that becomes public, and it's something that you can gain access to. You can't just log on to the App Store, it won't allow you. You need to get an invitation from me to do that, and that's how you can do. Just send me an email and just say about Dental App, and I'll send you the link, and you can gain access to that. But the suite of documents is really well worth looking at. It covers all aspects, including, within the app, actually, it talks about the knee-to-knee. There's a video. I know people say it's not fantastic, but it's probably the best one we've got around, and what to do, and also the suite of resources in terms of, some of them we're talking about the prevention pledges and things like that. There are other resources in there, as well as the apps that you can actually access. But very much would welcome you to get in touch. So just to conclude, as we stand, as I said, we worked on these series of events to try and really push the word out, not just the dental, but across the piece, that we have a role to play in the wider health and social care system. Starting well core, I think that we need to start to get the word out there, either within surgery, to expectant mothers to say, look, when you have a baby, it's perfectly all right. In fact, we would encourage you to bring your babies in. Dental check by one, obviously there are some national comms going on with that, and you would have seen some of that going along. But I think our role is to be part of that and kind of ride that along. All right? Thank you very much. By the way, I think it's not snowing anymore, can I just say? So that's not a worry. But actually, for you guys, not panicking and running out of here was really good. And I fully realise I'm talking to the converted. I'm always talking to the people that are more, it's a bit like the inverse care law in terms of healthcare. But if you've got any queries about this, about what we are hoping that we can all do together, then just let me know.